There we go. Una kusha una kabo. Una welcome to the Wẹll Bɔdi Better Pass Gentri program. When a salon people that don't learn boku book, now they bring and to now. Me name Timu John Fuller. Me not to medical professional, me not to health professional. Me a business IT consultant and they deal with computers and data privacy and security and stuff like that. Now then me specializing. But the people out there at the panel are people that we don't learn boku book. We get a variety of people that with varied skills. Some nurses, mental health nurses, general nurses. We get general practitioners, when are GPs. We get people that when are emergency medicine consultants. We get public health people. We get nutritionists. We get pharmacists, so on and so forth. Today, at the 68th session, we talk about babies born to hepatitis B positive mothers. Basically, we get mama, then we get hepatitis B. So today, Auntie Nafi, they look into that for see how them beginning the how this thing will affect them, how the mama then get for which they get for do for make sure so they prevent the beginning and not get them, and if you don't get them, which you need for do for manage, their sickness, then they quite say, no, I mean, I learn from them book Maya. So I feel very privileged just as soon for I learn from this. Like I said, I Miss Nafisatu Sumaray, now they present to today and today, on Sunday, the 20th of August, 2023. The panelists now the Bɔdi Better Pass Gentri team, like what I say, people in the day we learn different types of medicine or health profession. So if you not get any question, most likely we'll be able to answer them. Dear me family, there's a disclaimer. We not go able to provide individual advice. Not to say we not want to do more, but the problem is we don't know on a medical background. So we're not able to provide individual medical advice. We will provide general advice. So if we get any story way similar to you, yeah, my family are similar, no more similar, but not to you. They talk about, please. Okay, let's move on. Yes, this group, some of you wonder, we, the class say when salon people that we don't learn boku book and they bring Antona, because of we lack we country. We do in Krio specifically for we own country people them. Other nationalities then can join us when I see and English woman, but they manage with the Krio. We get other nationality in we can join with program. But predominantly now for we people them we they suffer with some man no understand English. Then you get some man we understand English, but some 10 days we sit down before doctor, which then they tell you, which giving the news that they don't give you, you understand. But now so they try to break things down to a granular level so you go understand then different sickness they are and how they catch them and how to avoid them. But if you don't get them, how to manage them. Okay. Like what I say, we know now, so if I'm older, we know they get paid, we do normal because we like people them. But also, we plead to people them where they benefit from the show already, we ask, do ya, una pass the message around to other people, let them self benefit. Okay, if you know people that will not face a good benefit, una pass the message and let them know. The recorded programs can be on YouTube and Facebook. So if you miss the program, always go on the YouTube and Facebook channel, you'll be able to find the recorded version there where you'll be able to watch. Okay. But also, there one more appeal. If you know of anybody or any way for the way we get this on radio, TV, and at all, we open for listening to offers or any suggestions. We're not in charge for the program. We're happy for give them for free. All we want are for let people and benefit from them. We don't do this program for we self. We do them for the benefit of the people that we really need them. So there, if we get away for let reach the general public, the masses not all, we're happy for listening to you. Okay. Okay, the copy they say the program is Facebook and also able to contact you on WhatsApp. And this number is the phone number you know go get them. So if you get any question we will ask, maybe you shame for us on the forum, now with the program they go on, you shame for us, and you can contact with it. We will try our best for give you as much advice concerning your question as much as possible. Okay. So as they say, if you ask questions, some of we will bold enough, we both for turn the camera on or for ace we are not and ask question and talk about some Monday like in the shame or maybe the environmental side. It's noisy or not good for public viewing. So what you can do if you ask question, if you look on your screen, now so your screen will normally look like. If you look now, you get 3 buttons. If you press on that day, you can able use the chat where you go chat like I don't know where you chat on WhatsApp or Facebook. You send your message in, I go read them out, or the presenter will read them out at the question and answer time. But also, if you want to raise your hand and talk, you can use this button here. If you look at me there, raise your hand. You can use them, you ace your hand up. But also, if you're not happy to do all of that, no worry. Turn your camera on, ace your hand up no more. If I see you, I will count you. There, if I'm not count you quick, means I ignore you. But once I don't see you, I'm going to acknowledge that I don't see you. And I will try to make sure I come around to you. Okay? For the final bit, I will say thank you very much for joining today. If you get any suggestions, questions, or feedback, we will try for doing. Okay, so send me an email or I can contact you on WhatsApp and tell you say John, I don't like your voice, or John, I don't like the idea present. I will look at ways for for improve. Or if there's a certain topic they want to listen to, or maybe want to repeat, let we know by this way. So now another yeribo me boku talk like I hand over now to the master of himself. Well, I will say the missus of himself. They will always sabi in subject like can take we through the session today. And I thank you very much. Until I feel ready, you know. If you're able to unmute yourself, you didn't unmute.
Sorry, thank you so much, Mr. Fula. Just share my screen now. Make I know if you see my screen, okay?
Yes.
You see my screen?
Yes, we see.
Okay.
Yes.
Thank you for joining. Good morning, good afternoon, good evening, wherever you are day. When I don't hear from Mr. John Fula, when I'm a colleague and waiting this way, body day what. Today, me when they talk to una so, my name is Nafisatu Sumaray. People they know me as Nafi. And they can't talk to una today, but babies born to hepatitis B positive mothers. But before I go there, I want to tell you a little bit about myself. Me, I'm a nurse by background. I studied at Salome, the National School of Nursing. And I qualified as a nurse more than over 20 years ago. And I worked there first before I came so in England. And when I come back here, I work as nurse and ward, for about 8 to 9 years. Then I decided to move away from clinical hands-on patient nursing into public health. So now mainly we work on disease prevention, control, and non-infectious environmental hazards. And then I don't do for the past 10 years. So today the topic now, babies born to hepatitis B positive mothers. Before I begin to talk about that, I'm not going to go straight to the main topic. I go and give you a little bit of idea of what hepatitis, because I want to let people that we don't understand about the infection, let them get that brief. Now just briefly, I will touch on them before I come to the main topic, which will be about the babies then. Let me put on presentation mode. So as I said, at the topic, this is what I talk about, but the things that I will touch on today now, we will look at the definition of hepatitis in general. I will tell you the types of hepatitis that we I will then can talk about hepatitis B when our main topic today. I will tell you the types of hepatitis B we'll get. I will look at global statistics. That they mean what we know around the world in terms of numbers for hepatitis B. Then they will include the Salon statistics as well. Then I will talk about signs and symptoms of hepatitis B. Then we will come out to the main topic today when a baby is born to hepatitis B positive mother. It means say the baby then way woman the way hepatitis we get hepatitis born, and then baby then they can tell about today. I will also tell about how the mama will transmit the infection from in the mama to the baby. I will tell about the preventative measures the way the WHO, will be the World Health Organization, where they advise the whole world on health matters, waiting they recommend for them picking so and the mama them. Then we will look at the challenges the way they will face all over the world for try for bring hepatitis B for pull and come out as a problem in the world. I will tell you about vaccination for them picking so, and also I will tell you about how to manage the picking them where they already get the infection. Then lastly, I will talk to you about some take-home message, what I will take home, I will share with our relatives, friends, and families, etc. And that includes a video. So when I hepatitis, when they tell you say somebody get hepatitis or you get hepatitis, it means say inflammation of the liver. It means say the liver swell. It means say the liver troubled. The liver not day as normal as we expect them for day. And so now they see this diagram now, yeah, this one show how a healthy liver for day, liver way normal, we don't get no problem. Then this other one they show a liver way inflamed, we don't swell up, we don't become troubled. What in the cause hepatitis? We get a group of germs that we call virus, and then they cause hepatitis. When the virus enter your body, it cause inflammation to the liver. And not a normal virus, they cause inflammation of the liver. We get some other thing that we call non-viral hepatitis. We mean say the liver don't become inflamed due to other causes. Where example of an can be drug-induced hepatitis. It means say you don't take medicine, whether a tablet or liquid medicine, way bad to the liver. It's toxic, it means they bad to the liver. They don't make the liver don't inflame. Or alcohol-induced hepatitis, women say you drink alcohol plenty, past the recommended amount where they say person for drink, and you drink over a long period of time. So then they say will make your liver will become inflamed, you get hepatitis. So we get 5 types of hepatitis. We get A, B, C, D, and E. But for them 5 types here, so now hepatitis A and E, then infection they get from where you eat food, where contaminated with the virus, or you drink water where contaminated with the virus. So we can call and say the way forget the one at the fecal oral route. Women say when somebody go past toilet, where go empty Bεttεh, the toilet, the stool, it gets the virus contaminated, and that contamination they come up from that stool into people in mouth, they drink them or they eat them. So if somebody get the virus, you go use the toilet, you know what's and fine. You can prepare food for people there. You can contaminate that food there, and then people they eat them, they will get sick. Or water we contaminated with the stool. So then you go and fecal oral route because of that way they forget them. If you get hepatitis A, your body can infect them, you can become immune for the rest of your life. You know, they get like 2 10. And another thing we find for noble hepatitis A is that now vaccine preventable infection. Vaccine they will prevent hepatitis A. Hepatitis E, we don't get vaccine for it, but I understand say China don't get a vaccine where they don't license it, but other countries they don't get vaccine for hepatitis E. B and C, now they are the one they win a blood-borne virus you get with B, C, and D. When I say blood-borne virus, I mean say infection where they get from blood or body fluid where contaminated with the virus. So I say body fluid like a semen, you know, vaginal fluid and saliva, etc. Then when they all contaminate, if you contaminated, you come in contact with and you're not protected for the infection, then you will get them. Hepatitis D, now one way now only people that will get hepatitis B now they affect. In other words, what I mean by that is if somebody will not get hepatitis B, it come in contact, it exposed to the hepatitis D virus, that virus not will survive now in body. Because for let the hepatitis D virus survive, it need the hepatitis B virus for let it survive. So now only people that will get hepatitis B, now then they contract hepatitis D. So now, what's in hepatitis B? The specific topic we'll talk about today. Hepatitis B, now a liver infection where now a virus where they call the hepatitis B virus, now they cause that. An incubation period for this infection now from 30 to 180 days. When I say incubation period, I mean say from the time where the virus they enter your body to the time where they present symptoms. That period they now call incubation period. So it can take up to 30 days to 180 days, when you 1 month to 6 months. So you actually get a longer incubation period, hepatitis B. The other thing we need for is a vaccine preventable liver infection. Vaccine day where they prevent hepatitis B. If you check your status for hepatitis B, it shows say you no positive, you negative, and you not get natural immunity already. It means you're susceptible, which means you're at risk. If you take the vaccine, it will prevent for you get up. So they get a vaccine preventable infection. It can be acute or chronic, where I will tell you later in the next slide, what I mean. Then, excuse me, one thing we need to know for say hepatitis being a global public health problem. So it is all over the world, not only in a salo it is problem. The whole world they get hepatitis B, where they can really point a cause of concern. Hepatitis B is a serious and deadly disease, means to say it's very serious and it kill. It affects anybody. It affects pikin, it affects man, woman, old people, young people, all it affects. And inside America, normal, just inside America, now 2.2 million people are infected with chronic hepatitis B. And 40% of people that will get hepatitis, they can end up with liver cirrhosis when the liver they get scar, or they end up with liver cancer, we go cause their life, they will end up lost their life if you reach to that stage. The other thing we need for know is hepatitis B. It is spread easily. They come up from one person to another. It's very easy for spread among people then. And it's 50 to 100 times infectious past HIV. Hepatitis B, the same way they get HIV and the same way they all the transfer, but we make up how infectious it be, how easy for transfer. Hepatitis B now 50 to 100 times compared to HIV. And the virus, that hepatitis B virus, it can survive outside of the human body for more than 7 days. And if somebody come in contact with them, even though it only is more than 7 days outside of the body, it can still give that person the infection. And we also know, say, people the way they live with hepatitis B when a chronic one, 2 out of 3 of them no say they get it. Because not all times somebody they get symptoms. Some people they get it and they don't get no symptoms, but they pass on to other people there because they don't say they get it and they don't know what to do. So now a problem all over the world. What are the types of hepatitis B we know? We know say hepatitis B can be acute. Women say in a short-term infection. The symptoms can last for several weeks. It can go up to 6 months where you get the acute type, where you just get it. Maybe in the last 6 months, you don't get it. When they say somebody get acute, so they look and say, well, you just get it maybe in a 6 months ago, because I remember I tell when I say incubation period now about 6 months. Either 6 months ago or 3 months ago, 1 month ago, something like that. So we'd expect the body for fetam. You know, if you get a good immune system, your body gets good. So Jaman, the way they fet for you, for let your body, you know, catch infection. If you catch infection, say if they fet the infection. Then by 6 months, we will expect so your body will fight the infection, it will heal, then you will become immune for life to hepatitis B, you know, catch them again. In the unfortunate situation where your body not fet them at all, it will remain as chronic infection. Then it means it will last long, you will live with them for the rest of your life. Because you not get cure, then the treat them, but you not get cure. So once you get the chronic one, you go for live with them for the rest of your life. And we also know, say, the chronic one, sometimes it can progress, it can carry on for give person cirrhosis of the liver, women say the liver will get scar, and sometimes it can lead to liver cancer, and the person can lose his life. We also know, say, age they play a role on whether hepatitis B will become chronic or it will become chronic or your body will fetter. It means, say, the younger person they were infected with the virus, the higher the chances for, say, it will become chronic. Now, that's make why I go tell about the pikin, and this is one of the reasons we make for take them very seriously, but baby, they way they born to hepatitis B positive mother, and make sure, say, we do within the WHO recommend the follow prevent them pikin for get them. Because imagine if pikin gets hepatitis B at a younger age where baby, it likely say it will end up with chronic one, where it will end up for live with them for the rest of their life. So these are the chronic hepatitis B and acute hepatitis B. So what do we know about the statistics numbers in terms of the whole world? So we know, say, all around the world, 296 million people are affected with hepatitis B, chronic hepatitis B, all over the world. And we also know, say, every year, 820,000 people they die from this infection around the world. So now a big problem. If you look at this diagram, and I will see, say, different regions them get different number we affected. I know I'll go through all as soon as I see them, but I will talk about Africa. Every day, 82 million people then now they're infected with hepatitis B, chronic hepatitis B around the world. So in African region, number 82 million. In the other regions, there, of course, when I see the earlier. So now a big problem where this amount of statistics are affected, the one who all affected, then 820,000 people they die every year. A big public health problem. Now, what do we know about Salon when we young country, we come out to some of we day? Well, some people that when are experts, they may do one study. We carry on until 2022, and then complete the study. Then find out, say, Nasalo, 13% of the population, they're affected with chronic hepatitis B. 13%. And they also say, adolescents and people that were up to the age of 19, people that will survive Ebola, people that will live with HIV. This PWH means people living with HIV. And also the one the way they reside in the northern part of the country and the southern part of the country, yeah. They say that them being hepatitis B boku one compared to the other parts they were in the eastern part and western part. So if when I look at this diagram, and then see say the northern part, 19% of the population they get hepatitis B. The southern part na 19.7%, western area na just 11.2%, and eastern part of the region na 10.1%. They say, this study, when I read bottom, they say, they don't know exactly what make get the difference in this number, what make one area affected past the other one. But then things say, it can be saying like access to care, maybe the access to care for the inside and we get high rate is different from the access where the other people that they get, we don't get better number. Or maybe the other way get the high number, they know they take the vaccination where they offer them at the place they say, but then find out saying that 13% of the population affected. So then waiting and find out, then they can say it make a necessary for less salon go put in place, implement national preventative measures them, or make them control hepatitis B in the country. And for let we safe now we country salon, we able to meet the 2030 goal where WHO set for the one world, say by 2030, the world for don't eliminate that means for don't pull come out hepatitis B as a problem, as a public health problem. So for let we able to achieve that day, we need to put preventative measures there in place. We for do that. Another study where I look at where they do in 2021, in show say hepatitis B na salon na 21.7% na affected. So we don't get two studies. This person talk about 13%, this one talk about 27.1%. But either of them study also, then they show say hepatitis B na problem na salon. Because if 13% or 21.7% affected, then that's a big number compared to other countries. They are just 3%, 5%, 4%. So we need to do something about hepatitis B in salon. The endemic in salon, it means that it did all the time, it did around it. We need to do something. What are the signs and symptoms of hepatitis B? Well, not all man where they get hepatitis B can get symptoms. Even the other way they get the new infection set, when an acute one way just get them, they're not going to show symptoms at all. Now, it make it really, really serious problem because you spread away, you don't even know say you get them. But some people, the way they develop symptoms, if they develop symptoms, some of them symptoms they are not even going to develop, they will put here so. You go see the person go feel like for say one vomit when they say get nausea and feel like say one vomit. Some man will actually vomit. Some people will lose appetite, will get belly go out because you know say the liver inside the abdominal cavity, then at the belly go out. They go get jaundice, then the eye go yellow. Where lay people can call us and say, that person get jaundice malaria. We see eye yellow. Hepatitis can cause her. Some people are wearing dark skin people and the eye more the same, but people are wearing white skin people then you can then at the eye as well as the skin sensitive can go yellow. The urine can show dark urine, even if you drink plenty of water for the day, it can still show say urine dark. They can feel tired, people can feel weak, you can get joints pain. So these are some of the symptoms that we get hepatitis B where you will display if you show any symptoms. Now, what I don't tell you so far, just general brief idea about hepatitis B and hepatitis in general. And they come now to the main topic for today. This now is born to hepatitis B positive mothers. Picking the way woman the way get hepatitis B infection, what I don't tell you about so where they positive. That mama we get Bεttεh, or you get woman we get hepatitis, you get Bεttεh, in picking where they born. The picking there at risk even before you can at this world. Before the mama born and set the picking, then they're at risk. And then picking here, then they're at high risk for acquire this infection from the mama. Then the mama will pass the infection to them. And particularly women will get high viral load. What do you mean by that? It means say the number of virus within inside the blood is beaucoup per smack. So if Bεttεh woman, you get Bεttεh, then you get hepatitis B, then check your blood, then see you're positive for the infection, then go ahead and check almost virus inside the blood. If you beaucoup too much, then mama then your risk for passing to them is really high. Also, mama will get this test, hepatitis B test to get different markers that we can look for. This is one of them. This is what they call hepatitis B antigen. This test, if it's positive, it shows say the person infectious because the virus they replicate. It means that the virus they grow, they grow, they multiply the virus. So if this test positive, then the mama in viral load high. This pikin where this mama go born, in chances for pass the infection to the pikin is very, very high. In fact, any chance for passing to a pikin. Now, 70 to 90% chances say that mama, they will get high virus load and we get E antigen positive. You get 70 to 90% chance for passing to a pikin. If we not do anything at all, we not do nothing but for that mama, they ain't pikin. Compared to the mama way, in ion Hep B antigen negative, in a 10 to 40% chances get sick, in will pass on to a pikin. So this test, all the tests are important, but this as well, very, very important, this Hep B antigen. So if you then at least call a health professional, you deal with pregnant women them, or you elect not a pregnant woman, you deal with you deal with picking them. When you come for look at this hepatitis B virus, it's advisable for do the full markers, not to just for check whether the person negative or positive. You need for check the E antigen. We will give you more information and guide you how you actually plan for this mama for picking. Now, what do we know about picking them all over the world? We get hepatitis B under the age of 5. Well, globally, that means all over the world, hepatitis B is a problem for picking them under the age of 5. We know say 6 million, over 6 million picking them, 367 and some picking them affected all over the world with hepatitis B under the age of 5. And again, by different region then, and then put some, this region, American region, they get 51,000 above, Europe get 147, Western Pacific, they get 365 above that. We in Africa, we get 4,310,000 picking them were affected with hepatitis B in the African region. So with this statistics, this global statistic, they show we say hepatitis B among young picking them under the age of 5, no problem all over the world. We need to do something for try and pull come out hepatitis B as a problem all over the world. Now, let's look at Salone statistics. What do you know about picking them for Salone in terms of numbers? Well, one study where they do that same study where they do, we end 2022, in talk say, picking them from 5 to 9 years old, now they may get low hepatitis B. They say about 1.6% among them picking up. Then the younger one, they younger than 5 years, they only get 2.9% according to the new study where they do. So I look, and maybe we'll see more statistics apart from this one. See, but sometimes it could don't go up more than this, or maybe it could go less. Now this time you will see for Salone statistics. And another study also where they do in 2019, in say 6 to 11% of Bεttεh women they get active hepatitis B infection as Salone. Then find out say this percentage of Bεttεh women they get hepatitis B infection, and then this percentage then likely will pass on to them picking if we not do anything about it. So inside Salone self no problem. Now, how mama they pass this infection from into a pikin? Well, all over the world, we know say the most common way for let mama transmit to a pikin are doing the way they born the pikin, they call them perinatal transmission. And not mean say other way than not the way mama they pass them to the pikin, but now this is the common one during the way the pikin they pass through mama and impact them for kind of this world. You go open your eye to your mama in body fluid, you open your eye to your mama in blood, blood go in motor, your eye, etc. The pikin no exposed. So now one common way that they way mama they pass them to a pikin. The other way pikin they get and they call it horizontal transmission. So this one away get close contact, the pikin they get close contact with. Maybe in other pumping pikin they in early childhood, they don't begin big now, they get contact with. Even in mama self way born away get the hepatitis, it can pass on to her. So if we not do nothing for that pikin, they for protect her. Or if they play with pumping picking them, insect can pass their infection later in pumping picking them during the time way if they play with them, picking them can get her. So if any picking gets them, the other one not protected, they always get the infection can pass over to the picking where they play. If you get any body, if you wound, not to just by touching the picking, if you get any cut, the picking body fluid enter that other picking way not protected, insect will get on that way. Then say then 2 routes here we'll talk about so this perinatal transmission and this horizontal transmission. Then say that they respond for most infection where they continue for be chronic pan picking them. Then say transmission.
On the long way, on my body.
Well, my family, I don't know. Auntie Nafi?
We also know they get infected with hepatitis B.
I think we lost you.
Then say they will develop about 95% chance day for let the pikin will develop that infection into chronic infection.
I think sorry, if you go back few steps, we lost you there briefly. So if you start on this page again from where you start on this page. We lost you briefly.
Okay, somebody, you say I lost connection?
Yes, you lost connection. Not John. Yeah, you lost connection. So if you start on this page again, just start from this page. Which side it is? So just start again and continue, please.
Okay, but when I did now, eh?
Yeah, we see.
Okay, sorry about that. So what I'm going to talk, I say for let mama pass the infection to in Peking, all over the world, we know say the common way for person away doing way mama they born the Peking doing childbirth, we call perinatal transmission. Now, one of the common way that they for pass the infection. You know mean say other way than other way the mama they pass on to the Peking, but that way then the common way. Then we get something called horizontal transmission, where after all the mama don't born the Peking, where they nurse the Peking, where they raise the Peking up during the early childhood of the Peking, the mama can pass on to another way. Or sometimes the Peking they play with in company Peking, you know, way infected, if you're not protected, they can still get another way. We say then two roots here, this horizontal root and the perinatal root. Now they're responsible for most chronic infection. If you pass through that way, they not do anything about it, the Peking can move from to chronic infection. And then say, mama then we get high viral load, as I did not talk before, where the virus is high in the blood, where they check out. Then say, then they pass the virus to them Peking. They say, it's easy for letting mama then pass them to the Peking. Mama we get high viral load. It's common for them pass them. And if Peking don't get infected, they say 95% chance day for let that Peking they develop chronic infection and live with them for the rest of their life. And we also know, say, 1 out of 4 of them Peking and they can eventually die from problem the way before saying that the liver complication then are cause because you don't get chronic infection. So it's very important that we do something for make we prevent for let mama not transmit infection to the Peking, where the Peking young so. Because we don't know, say, Peking, when you get the infection, we're young. The chances for letting you live with them for the rest of your life at all. So now, these are the different stages the way mama they transmit this infection to in Peking. We get Bεttεh. We get this first cycle called during gestation. It means during the Bεttεh. Now, inside the Bεttεh, yeah, placental infection. That we would call after birth. During that one day, the mama can pass the infection. If we get any placental leakage, where mama body fluid, blood leak from the placenta into the Peking, it can cause for let the Peking get the infection that way. The mama inhales them in blood. Sometimes they will get this test so can do where they can do for check if Peking gets any abnormality where they go born with, where then they take fluid from the fluid where the Peking they don't insert in and call it the amniotic fluid. During that process, they for do this procedure, the Peking can become exposed, you know, to infection, to hepatitis B infection if the mama gets her. So we get the placental infection when at one stage of the pregnancy where the mama can pass on to Peking. Then the other time where the mama can pass on to Peking are doing this where they say transmission during delivery, what I don't already tell about when a perinatal infection. So the mama in vaginal fluid, you know, the blood where they mix during the tell the mama they born the Peking go open the eye by mama in body fluid them. So tell the blood go inside the eye, the fluid, body fluid go inside mouth. During the day between the 32nd to 40th week when a woman can born Peking, when they born the Peking, there is chances for say if they pass the infection to the Peking during that way. And then lastly, now after we don't born the Peking, we call a postnatal infection. They don't born the Peking finish, they get a bobby now during that same day can play the breastfeeder, they can pass on to them. Or if mama the Peking come in contact with the mama in saliva and that time beat within a mouth, you know, all in three different stages, yeah, the mama can pass the infection to in Peking. Now, within the WHO, in a World Health Organization, when this organization they for advise country them all over the world on health matters and how we can actually put things in place for control and prevent infectious diseases. WHO say they say prevention of hepatitis B from mother to child or early childhood transmission. They say that the most important strategy, the most important way for control the hepatitis B virus in any country, if you don't prevent for let mama not pass on to in Peking, then you don't get a good way, a good strategy for prevent for the hepatitis B come out as a problem in any country, and any try for talk. So how we go do this? WHO say all belle woman, everybody will get belle all over the world. They say them for test them for HIV, syphilis, and hepatitis B surface antigen. At least 1 time per the belle, and as early as possible during the early pregnancy. And every belle where the person gets them for test them. So we for test all pregnant women for 3 infections, HIV, and syphilis, because all of them 3 infections are they passed from mama to pikin, but it didn't just hepatitis B no more they talk about. You for do at least 1 time per the belle, but it better do as early as possible per the belle. So the belle young do at that time. And if the woman get belle 5 times, you for check on 5 times per each pregnancy. So that you go plan for the pikin and the mama when you know say the mama positive. Imagine you know say the mama positive. Their mommy go born that pikin, you know, it go pass the infection to the pikin. Nobody know. So now make it very important that then test the belle woman then. Every pregnancy for testing for hepatitis B. They also say any woman where you don't test her positive, any pregnant woman we get viral load weigh more than 200,000 international units per meal. When I saw that they measure international units per meal. So any 1 meal of blood, if the virus pass 200,000, that mama day for receive medication when they call tenofovir, the antiviral medication against virus. At 28 weeks of pregnancy, I forget that one, they take born in pikin for they take that medicine. Because the mama then will get high viral load. Then they transmit the infection to them pikin. And sometimes even if say you give the pikin vaccine, because then I will tell you later about the vaccine when they recommend vaccine for pikin. You give the pikin vaccine, you give something we call hepatitis B immune globulin, when already made sojamande way we call an antibodies in the medical field, but the other way for talking about sojamande. Now already made sojamande where they specifically for prevent pikin or anybody for get hepatitis B. Sometimes they because the mama virus is so high. Even if you became born, then get their hepatitis B vaccine the same day when they born up. Then get back this sojamande, the made and sojamande. The picking, then again all the vaccine the way you need for get after the way you don't get the birth dose. The picking concern and they can still get the infection. So now make it very important we check the viral load of the mama and know what for do for her. When we check this viral load, you give this medication. It is suppress the viral load, it reduce the number of virus we get at the blood for they able to protect the pikin. So now I make it very important, I say for checker. But they also make some flexibility around this testing because they know say some country they not get this the availability for test viral load now some country there. You know they so what they say, okay, if na country we not get the availability for do this viral load, we get an alternative. They say this test what they call hepatitis B E antigen, what I've been talking about before. Why I talk say that if it positive, they show say the virus they multiply and the person very infectious. He say if you're not able to check the viral load, but you check this test here, so you can use it as an alternative for let the mama qualify for take this antiviral medication. It's simple the logic. If this test they show say the virus they multiply, then you're not able to get the exact figure. You assume say the virus will multiply, and it will multiply until they reach this or even past this. So use it as an alternative for actually determining whether the mama needs to take the antiviral medication. Then they also recommend say all picking the way that they born, including the one that we get low birth weight and the one that we have premature pick. When they say low birth weight, say the picking born below when they weigh I think they below. I think I don't know for check the figure. I think low birth weight picking the one that we have obstetrician or midwife can go no better. But I picking the way they born below, I think either 1,000 or 2,000 grams, 1,500 2,000 grams. When they're premature, then for receive the first dose of hepatitis B vaccine before they left the hospital, preferably they say within 24 hours when they born them. Then call on the birth dose. That's what they call on birth dose. So WHO recommend hepatitis B vaccination birth dose for all pikin when they born all over the world. Whether a mama gets hepatitis B, a mama not get hepatitis B, they recommend say and give them pikin and they all infants. Then he said that birth dose they then for follow them by 2 or 3 more doses then at least 4 weeks apart. When you don't get the birth dose, get another additional 2 or 3 doses then back at least 4 weeks apart. Now they recommend for all pikin, all baby. And from 1992, WHO also say let country then make sure say they put hepatitis B vaccine as part of the routine vaccination. When they say routine vaccination, a vaccine the way the country don't all get the program and for say we born Peking. Now this will get at this time and this so now routine. So they may not say that we integrate hepatitis B as part of that routine vaccine B. So infants hepatitis immunoglobulin, where I talk say now the ready-made antibodies them also German the way they for fight hepatitis. Then say instead you can use them as preventative treatment shortly after birth, in addition to the vaccination where the Peking will don't get. But one thing for know is not to all countries get them. This is not a WHO recommendation. Now make I put in red here, so I mention yeah, but I put on this say some countries then they use them in addition to the vaccine, but not a WHO recommendation. So sometimes they not to all countries are available. So the most important thing, the main thing now for make sure say the Peking get the birth dose of the vaccine. Make it get them within 24 hours where they born them Peking a day. If we do that day, we go reduce them Peking ya, we get high risk Peking them for get them. And even the Peking themselves, we not get high risk safe for get them. Forget the infection. But even though as WHO recommend, we still get some ongoing challenges and all around the world. But who Peking they miss out on the benefit of hepatitis B vaccination. They not they get the birth dose at all. They need to get the vaccine. Inside 2021, over half of the world Peking the way they born, they not get them birth dose, the hepatitis B birth dose within 24 hours. They not get them. So these are challenges they face all over the world. Some countries they not implement it. Salon one country will not implement the birth dose it. Would they give with Peking and a Salon hepatitis B vaccination at 6 weeks? So imagine if the Peking go down get exposed from a mama by 6 weeks before they get so they don't catch the infection. That Peking they will therefore progress to chronic stage. We also know say out of the 194 countries in the world now, 119 countries they don't implement the birth dose. When they born Peking in a hospital, then they get the birth dose before he left the hospital. We still get about 75 countries that we not implement it. When they we fall, we salo, they among them 75 already. Then the other challenge now, low coverage of testing and treatment. Some countries they not get any test. Sometimes they need test Belle woman them, sometimes they need test Peking them, they need even test the general public self, we not to just Belle woman and Peking. And they know they get access to treatment. So these are the challenges they will get all around the world for try for pull come out this infection. But Peking them as well as the general public. So I look at countries then, this map they show countries the way not implement it, and this country the way don't implement the birth dose. All the one the way they in yellow, they show say, they're not implement, I see they show no. These are country then all these yellow side are country that we not begin give the vaccinate at birth. The one the way they in blue, they show say they don't begin give the vaccine at birth. Some then they in blue, they don't give, but then they only they give to high risk Peking then, like England, for example, now high risk Peking then they give at birth. When I say high risk Peking then, like a Peking we born to hepatitis B positive mother in a high risk Peking then they give at birth. Then side and now when a black, you know, applicable for them and give the vaccine at birth. So they're not a give. So this is now a diagram where they show how it be problem in terms of the challenge. Wait 30 days on country, they not implement the birth dose yet, even though a recommendation. Now, what do you know about vaccination for them PKR? Them baby where they born to hepatitis B positive mother. Well, we know say if we not vaccinate them PKR at all, where the mama they born there, the mama positive for hepatitis B, born in Peking, they don't expose in Peking to the hepatitis during the Bεttεh or where they born her. If we not vaccinate them Peking, 9 Peking out of 10, when I see the number way big, but 10 Peking them, all the 9, it's possible say they will get hepatitis B. And it will possible say they will progress to chronic hepatitis B, which will lead to serious health problem in them Peking a day. Now, big number, if every 10 Peking, 9 out of them 10 and they go get the hepatitis from the mama, if we not do nothing. So we need to begin think what we get Belle woman they deal with. What we get Belle woman they deal with for say, let her check this Belle woman for hepatitis. Make her do what WHO recommend. Make her do this for the Peking where they born her. Otherwise, that Peking they will end up get chronic hepatitis B, what will make it lead to serious problem, will end up losing life. So I look at vaccination schedule in other countries and when I compare to waiting there around the world, you know, this now UK vaccination schedule. They tell me about the routine vaccination as well as the vaccination for picking the way and high risk picking them. So then talk saying if you give the vaccine at the appropriate time when they born the picking immediately after birth, then say you could prevent 90% of cases then for acquire this infection from the mama then. 90% will be prevented. So in this diagram, they show this is not the age of the Peking and Aya. this middle part, the routine vaccination for picking them, where not to high risk picking them, just not just routine. Then they get the hepatitis B virus at 8 weeks. The picking them when are just normal routine program then they on. Then they get at 8 weeks, 12 weeks, and 16 weeks. This is not combined vaccine we call them 6 in 1 now. So the other name is hexavalent, where it prevents 6 infections. Diphtheria, tetanus, whooping cough, a day for polio, a day for one infection, what they call Haemophilus influenza B, when a bacteria infection, we say if they catch picking them, then they get the hepatitis B. So then they get 3 doses on routine. But I want to tell you something now very important. You see this section where they put X, then they tell you, say, picking the winner, they're on the routine program, they're not supposed to get at back. But they put X now, and this X they explain and down here. This X they say not forget that, but they put plus sign next to the X. It means say, even though picking in mama no get hepatitis B, if the mama they take that baby they were born, it can go now us who side somebody they will get hepatitis B then that host. They say that picking they will forget and the first dose of hepatitis B vaccine before he left hospital go na that host who side he go become exposed to hepatitis B from that person then that host. So until the person get for involved for change that P, involved for look after the picking, for feed the picking. If that be the case, then the picking go there at risk for letting that person go infect, and one day either you get a wound, exposed to the body fluid or whatever. So because of that, then they recommend say the first dose of the hepatitis B vaccine when a monovalent, not to this combined one, they call a monovalent, then they give the picking before you go to host so that they go protect and make go catch the infection from that person where inside that host they will get the hepatitis B. Now we talk about the one that we get hepatitis B, we born to hepatitis B positive mothers. Then mama they will get hepatitis B. When I see the number of doses of vaccine where UK they give them picking any, at birth then they give them 1 monovalent. It means say this monovalent means not just hepatitis B they protect, not to combine vaccine. Then they give them monovalent vaccine at birth. Then they give them after 4 weeks, they get another monovalent. Then 8 weeks, then begin now the other one when I combine, when I in the same one, they want to accept they get C. Then they get combined one at 8 weeks, 12 weeks, 16 weeks. Then at 1 year, then get back monovalent vaccine. So if we count in total, then picking your way born to hepatitis B positive mothers in the UK. Then they get all in total 6 vaccines, and then they get in total before then they reach the age of 1. So when you reach the age of 1, then they test them for see if you don't get the infection. If actually the vaccine don't prevent the infection. So at this time, the program this way UK gets for the picking the way born to hepatitis B positive mothers, then put a strong program in place for them. Very strong program. Sometimes they say if the mama virus very high too much, in addition to this monovalent vaccine, then they give them that hepatitis B immune globulin. What I tell them about where I say already made soldier man the way they make specifically for prevent hepatitis B. UK they give that picking the 1 dose of the vaccine plus the immune globulin where I talk about. I look at America, what America they do for them babies then? Well, America themselves they don't implement the birth dose. This yellow section they show you about the birth dose. Then they give birth dose to every picking where they born in America. Then between 1 to 2 months, then they give the picking the second dose. Then from 9 months to 12 months, 15 months, they aim for give the picking the 3rd dose. This section, I always say 4 months, we get this color. It means a catch-up vaccination. What do they mean by catch-up is America, if you miss this 1st dose at birth, where then they try by all means for let us miss that. Then go give you, then go aim you for get this catch-up one, you can get catch-up one 4 months. The birth dose then they give, but if you miss any other one, then they give you at 4 months, then go one catch up you at 4 months. Then they move on for go give the other dose then. So then they give the birth dose, then they give 2nd dose between 1 to 2 months, 3rd dose from 9 months to 15 months. Now look at what in salon they do. I also look at salon vaccination schedule. This section at the left now at the vaccination section. All of these other sections, I know they talk about them. I just talk about this section at the left-hand side here. And so now they see from this salon vaccination card, we know they give hepatitis B at birth. You see here when they say birth, we they give BCG and we they give the oral polio vaccine at birth. Then at 6 weeks, now we they give the first, what we call them penta, then call them penta, because them 5 in 1. UK then get 6 in 1. So we get the 5 in 1 because there are 5 different infections in this vaccine we combine to prevent from picking them, including hepatitis B. Then they give the 2nd dose 10 weeks after. Then they give the 3rd dose 14 weeks. So imagine we not begin the birth dosage for give picking and salon. If the pikin born to mama we get hepatitis B, we know say it go don expose from a mama inside the belle or during the delivery. Then the pikin get for wait for 6 weeks before you get the vaccine. It go don already catch the infection by 6 weeks. And we know say because the pikin young, it can progress from go to chronic stage, and that pikin they go don get hepatitis B chronic. A mama not go even know safe. You go see no more the pikin they sick, and when you go something go do am now touch wood, go get to the stage where you go don't get to liver problem. We no what to go attribute and so now which this pikin because now the first one, now the only boy pikin, etc. So we need for put something in place for make we begin test to belle woman then na salon during the belle, plan for them with the pikin, give what I need for the antiviral jam, and then we make sure so we vaccinate the pikin at birth, not to just stay past them wait 6 weeks. We get a lot of risk factors of pikin and salon. We don't know if the mama gets the vaccine, so if the mama get the infection, unless we test. I don't know if they test it right now. I don't see no data where they show say they test the belle woman. But people are going on this call, we actually deal with belle woman, and we go actually able for know better than waiting me know. We not also know the also they carry that pikin they go. If person they get hepatitis B, we go even expose them before the six weeks they reach way for getting vaccine. So even if your mama no get hepatitis B safe, we not go don't pass on to the pikin. The person will say the pikin go contract and na us who side they go because you know say we get new baby in Africa, all man they total, all man they play with, all man help for bring up the pikin. Then if anybody among them people then they get hepatitis B, don't expose the pikin. So we pikin and they at risk, then they at risk na salon past say 6 weeks, we don't know what going to happen. And look at the impact of vaccination and hepatitis B disease. Now, then 2 areas, this Southeastern region and Western Pacific. I don't go over all of this, but I will just talk about one of these numbers here. This diagram, they show say vaccination gets a great role where they play for reduce hepatitis B infection in a country. See this region? From 1992, now they see say vaccinate. This red line, they talk about the third dose of hepatitis B vaccine. The blue line, they talk about the back dose. 1992, take up to here, 2004, where they see say the uptake be very low. Look where the number they creep now. See the line they creep, and the gray line now they show the number of infection then, hepatitis B infection then. See, now they show when this region not be they take the hepatitis B vaccine then better. You they see say the infection rate is high. Look at that, about 2,500,000 people and then get infected during that time around this year. Because they not be take the vaccine. When the vaccine uptake begin increase, you see, from this side and I begin increase. By the time the vaccine uptake don't reach up here, so we don't reach now, we now so the percentage around 90% don't take the third dose. Then around 30% don't take the third dose. We see say the infection rate begin count down. See, by 2014 now the infection rate don't count down. So slightly above 500,000 from 2.5 million. And the vaccination rate don't go up by 2014, you see. Now about 30% they take the back dose, and about 90% they take the third dose. So the infection rates don't come down. So this they show say vaccination they play a great role for reduce the burden of the infection per people them. So if we try and put vaccination in place now in the country, we go reduce the number of pikin them where they get hepatitis B virus, and as a result we go able to meet the 2030 goal where WHO all country they meet. So then baby are where they born to hepatitis B positive mothers. We for test them, we call them post-vaccination serology testing, where you don't take in vaccine done, you don't take in back dose, you don't take in 2 or 3 additional doses and WHO they recommend, or for UK, they don't give them about 6 doses. You for test them for see if the vaccination don't work. So now in a 2 ways for test the pikin. Either you take blood from the pikin arm, where you go get for need specialists for doing an hospital, or you do heel prick, where we call now so dried blood spot testing. Then they pick the pikin heel and take the blood and drop up and candidate and send a lab for go check them for surface hepatitis B surface antigen. You could tell them whether the pikin negative or not. What if I do for pikin away? Unfortunately, even though with the WHO they recommend the back dose, they recommend testing, they recommend for give subsequent other doses after the back dose. Unfortunately, sometimes they'll get some amount of pikin that will still get the infection, even if you do all these things with WHO see. So what if I do for them pikin and day? If you don't test the pikin blood as a health professional, you don't test the blood, you don't see say, you don't request testing for the blood, you don't see say positive. Well, you're supposed to refer the pikin to pediatric liver specialists waiting for pikin them. But then they will monitor that pikin day and treat them or make sure say you receive the best care we're supposed to receive. So the pikin go dey under constant monitoring by a specialist when we sabi about pikin the liver. And then can get an antiviral treatment for let them reduce, for let the virus not multiply by the pikin. Because you know, say the higher the virus, the more it damage the liver. So once the pikin under the specialist, they go to monitor viral load. If you need medication, they will give medication for let them reduce the replication. That means the multiplication of that virus for that pikin, they go reduce that. And if they get reduce that one, they will prevent damage to the liver. Because the main goal why make they refer the pikin to specialists and for the monitor. Now, for let them suppress the viral replication, make them give them medication, we go reduce the multiplication, the boku, for let the virus not continue for boku in the blood. And then it will reduce any inflammation to the liver, and then it go pull come out and it go reverse for let the liver become fibrous when the early stage of liver cirrhosis. It will protect the liver if the pikin dey under constant monitoring, because then the specialist will know say, okay, this stage the pikin need medication, this stage I need for do so thing for the pikin until that pikin they live, because you get for live with the infection for the rest of their life. So the best thing, better allow prevent them. I think will be the best thing. Prevent them rather than we sit down pikin and get the virus. What thing I take home message today? Why I want to take home? Why I didn't this call? If you didn't this call, you know health professional or in a lay person, take this message home. All belly woman for test them for test them for surface antigen at least one time per the belly, and during each belly what the person get, then for test them for hepatitis B surface antigen for test the woman, so we plan for her. Babies and born to hepatitis B positive mother. A lot of members say that there's high risk for get this hepatitis B infection, then safe. We will take this home message when we deal with kumbra them, belly woman them, make we know how for plan for them, because this is a problem. Then all baby them for receive the hepatitis B vaccination within 24 hours when they born them, for make sure say we follow them that vaccination by 2 or 3 additional doses, at least 4 weeks apart. Then, let remember say if we not vaccinate speaking, they will not do nothing for them. Then pikin away born to hepatitis B positive mother. We just left them so no more, we not do nothing. 9 out of 10 picking them will get chronic hepatitis B, which will cost them their life. Then the best strategy we will use for actually prevent for the hepatitis B come as a problem. Now we will prevent for them mama not pass the infection to a picking by following all the guidelines that they were them recommendation that they were WHO say. Then talk to your doctor. If you didn't have this call, you don't know your hepatitis B status. You're not a health professional, you need to follow your hepatitis B status, because if you're positive with hepatitis B, you know you can pass on to your patient. If you're negative, your patient can pass on to you. So we need to know his status, and not just for health professional, anybody out there, because within a salon we say hepatitis B endemic, it means it in the country, they widely spread. We support for know his status. So from here today, we go talk to your doctor, your health professional, made and check you if you get hepatitis B or not. If you don't get them, either you're negative, you don't get them at all, you're susceptible, then give the vaccine, or you're negative, but if you don't get them in the past, you don't get immunity, where you don't need vaccine, or you get chronic infection, or even acute one, because sometimes you need get symptoms. So try to talk to your doctor, make you know your hepatitis B status. It's very important. Then spread the word to your family. You party them, spread this word. Tell them, say, one simple blood test will save their life from getting liver cancer. Because when you do them, if you know so you get some, they will manage you, a specialist will go to monitor you. If you don't get some, then you will get prevention by vaccination. Then I take a message I want to tell you now. This campaign, this July 28th we passed now the World Hepatitis Day. This is the campaign where the WHO use for campaign for raise awareness around the world for hepatitis. Then call it one life, one liver. WHO they try for emphasize the importance for look after we liver. So now one life again and one liver will get. So for make sure say we liver protected. Access testing and vaccination. Get vaccinated if you're not already protected. Access treatment if you get sick. So now in this campaign, they actually recommend say, let me look after we liver. Because one liver will get one life. Then another organization where they call World Alliance for Hepatitis B. Then this campaign and then be used. They say can't wait. And then I've been in campaign July 28th when I've been World Hepatitis Day. This man they talk say I can't wait. He say he can't wait for letting test time for hepatitis B because he want for no. This Beloma saying, they wait for letting test time for hepatitis B, for letting protect and begin. This man said they talk say, no wait for letting get liver cancer from hepatitis B. Do blood test, let you know so you get them, at least you will get treatment where will make your life will prolong and get liver cancer when a complication for her. Then while they say make sure so you test your family for hepatitis B. You know, for wait for your family get tested. Now we know na status. Now we know what we're supposed to do. And the young campaign and they put on the day. Now I tell about this. I play this video from now way. Na Koidu Government Hospital. The young campaign awareness raising message where they do July 28 when I been World Hepatitis Day for the young residents, the local residents where they raise awareness. And they play for about 3 minutes long.
I'm Dr. Sonia, a medical officer at Koidu Government Hospital. Have you heard about hepatitis B infection? And do you know its modes of transmission? Also, do you know it's treatable and preventable? Now, let's talk about hepatitis. There's a virus which affects the liver, and there are different forms. We have hepatitis A, B, C, and D. But the most common is hepatitis B, which can be transmitted by body fluids, sexual intercourse, of course, with an infected partner, and also by mother-to-child transmission. There are various precautionary measures which can be adhered to. First, get tested and get vaccinated if you are negative. Also, use condom always as is advisable. Avoid multiple sexual partners. Use sterilized instruments always in and out of hospital care settings. Pregnant women are advised to get tested to know their status and get treatment if already positive, so that the infection cannot be passed on to their unborn child.
Hi, I am Dr. Lamali, the medical superintendent for Koidu Government Hospital. We can't wait to continue giving care to patients with hepatitis.
I'm Agnes Siamaturi, the matron of Koidu Government Hospital, Kono. We can't wait to raise awareness about hepatitis B in our community.
I am Patricia F.A. Clinical Program Manager for Maternity Unit. Having a healthy baby is the dream of every mom. We can't wait for our pregnant women to be tested and vaccinated for hepatitis B.
Hi, I'm Gentri, registered nurse at Gentri. We can't wait to get your family tested for hepatitis.
I am Mohamed Sumaray, attached to the clinic. We can wait to end the stigma and get tested. Therefore, get tested so that you can vaccinate.
Hi, I am Michaela Mirabadia, HR.
Oh, sorry, what am I doing?
Therefore, get tested so that you can.
Sorry about that.
Hi, I am Michaela Mirabadia, HR. As our goal gets towards creating a conducive and productive working environment for our staff, we can't wait to get tested for hepatitis B.
Hi everyone, my name is Wẹll, Big Manager. Our priority at the place is to move our staff and patients from one employer site to another. That's the reason why we can't wait to get tested for hepatitis.
Hi, I am Abubakar Samora, the project specialist for Pen Plus NCD. We can't wait to collaborate with our donors, partners, and stakeholders in providing potential health care for the poor.
Hepatitis is a global health problem, especially in developing countries. In Sierra Leone, we all have a role to play. We cannot wait to end hepatitis.
So that don't bring us to the end of the presentation. Now, na question time. Thank you for listening. Any questions from anybody? I'll be waiting. My colleague, Mr. Temujo, Fuller, talk on how you for ask questions. So I will pass the role back to my colleague for actually for lead on in the question time. Thank you.
Yeah, Auntie Nafi.
Yes, sir.
Thank you very, 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 very much. Me don't learn a lot, and I'm sure we people them as well don't learn based on the comments themselves who don't begin coming. Yeah, for people that really ask, you had to be join late. Yes, this one is recorded as well. It will be on YouTube and Facebook. Obviously, we'll get for just make sure we censor check them. Make sure say anything or the day we not for sure not public. I don't see Mr. Daboy and up already. I'm sure there's a lot of questions then where people then get. So we'll go to questions. Now we'll take Mr. Daboy on first. I myself get few questions for ask, but now important. So I will give you the chance first to ask. Then when I get space in between, I will come, I will raise my own question. Mr. Dabo? Laughing you. For some reason, I didn't see you.
I think you don't mute. Mr. Dabo, you never mute.
Oh, it's okay. I mean it for mute.
Oh, okay.
I'm not seeing name for some reason. Oh, there we go. Yes, boss. Mr. Dabo, how are you, sir? Mr. Dabo? I don't ask you for mute. There you go.
Oh, yeah. Okay. Thank you. Thank you very much, sir. I don't know. I don't know if I mean no more, but the volume is a bit low when they play the clip where the last clip where Nafi said very good. Thank you so much, Nafi. This an eye opener for me always. Anytime I can at this place, you got the 1 minute all the time. But honestly, this very important. But I get a few questions, but I will ask one first and see something maybe other people don't pick on now, then we'll ask the same questions. Oh. One, this back those problems we'll get now Africa. If that WHO don't talk say that this is not a requirement, why could they get issues with the back dose? Because you don't mention that. What's not the problem we will get when they get them? Now the people in the refuse for take them or not the vaccine no day. If not vaccine not available, because now 75% of countries, according to you, where they're lacking in the back dose, they never implement the WHO recommendations yet. That's now one of the questions I will get. I really want to know why, like Salon show, whether something that the vaccine are not available or now people that refuse for take them or whatever. I mean, now that I want to know if you can kindly just say if you know at all. Thank you. Then I'll get other few questions. I will wait. I will give opportunity for chances to other people. Let them ask first. If you're unable to ask the questions I will get, then I will follow them up with another questions. Thank you very much, madam.
Thank you so much for that question, Mr. Dabo. Well, the vaccine available in Salon. Waiting they're not implemented at the birth dose. Where WHO recommends say we born picking within 24 hours we born I forget the birth dose. Then with Salon, we not begin get at those dates. We they get at 6 weeks. Now they give the picking them. Obviously, if the pikin mama gets hepatitis B, go don't pass on to the pikin during the belly or during the delivery. So the pikin don't expose already. So you go there for wait 6 weeks before you get the vaccine. So it's available. All we need for doing for put in place testing for pregnant women. Where I don't see any data where they should say that they test pregnant women as a routine as alone. And make sure say the pikin and get the birth dose when they born them. So I don't know if that answer your question.
Yes. The back dose now what's not the problem we could not the get the back dose?
Because I guess they probably they're not implementing it in the country. Because if you look at the vaccination schedule, they begin post those at 6 weeks. Now the back area of the vaccination schedule, they're not put anything there about hepatitis B. I don't know if I will bring that there up. So
the implementation what it involved?
Well, the WHO, when they advise, then they tell you saying this for it left to the country in Department of Health or whatever responsible for for implementing.
Okay.
So Salon no implement the back dose it.
Okay, understand. Thank you.
So the country need for actually put in place.
Okay, I hope say until they're on recording, I hope say people then go listen now. Salon let them say we which they happy because this is not only disgraceful, it really bad on innocent picking the way likely they get exposure and they get into there. Where the government for don't do something but anyway, thank you very much for that answer. Thank you.
Thank you very much, Mr. Dabo. Something I want to add to this. The thing is, if we get anybody within the panel, we understand more on the situation on the ground, we will be appreciative because we can normally get doctors them in the audience as well. If they understand the situation better than we, and we will encourage them for letting them shed some light on this. Not to say we try for blame any government or any individual or any institution. We only go by the information where we get. So now make we can encourage, we can try for, because them doctors also get links to other people in back home, other doctors in back home. So if they're on the panel, we want to understand the situation better, maybe improvements don't be made, or there's a constraint why, then see how they happen, please feel free for ace your hand up or put your comment on the chat. So at least we go able to sensitize the people. As we say, we not sabi all things, we say if they land. So if there are things then we not know about, please bring them come up. Mr. Kojo, I see you don't put your hand up, but do you allow go to Mr. Sumaray first, please, yeah? Mr. Mohammed? Mohammed Sumaray? Mohammed Sumaray? Mohammed? If you press the unmute. Okay, I will skip you first. Mr. Kojo Krio? I think you're a doctor, isn't it?
Yes, yes, I've been a doctor, sir.
Yes, sir. Sorry, Dr. Krio. Welcome, sir.
Yes, good evening.
How are you?
I want to first of all congratulate the presenter, Nafisatu Sumaray. He presents this subject with so much dry eye, but I was really, really impressed, and all the data is fantastic. But since I started medical school, maybe 40-something years ago, I've been one where can actually ask questions. There are certain things where sometimes they can doubt people them. And over the years, I find out, it has paid off. Number one, I can start off with the subject itself, hepatitis. We say hepatitis virus. We say the virus is inside the blood. And why should it be restricted to the liver? Is it restricted to the liver? No. I can always tell you, say, every part of the body is affected by hepatitis. Now you have preponderance of, damage in the liver, but it does affect the heart. It does affect every part of the body. And that's number one. And, we always want to know how to protect ourselves from hepatitis. All the preventive measures we Nafisatu give is perfectly correct. But in the most recent past, I will say starting from Ebola, we decide for take matters into our own hands, especially myself, because the whole world was foxed. We didn't know where to go. In fact, WHO until we said they don't know what's in the happen. That was very scary. So number one thing, let us not forget saying a virus we deal with. And virus is a polypeptide rod wrapped up with lipid or oil. So the moment where you remove that lipid there from the outside of that polypeptide rod, which could be of RNA or DNA origin, the moment you pull that oil there, you don't inactivate the virus. You don't neutralize them. So, get any for infect anybody. So I can tell you, say, the simplest way for on the outside is to use a detergent, say like a soap. Any kind of soap. In fact, during Ebola, I tell them, say they can even use soda soap. Any kind of soap. It doesn't have to be, expensive, antiseptic soap. Ordinary 72% soap. In fact, when I did that on the radio, 72% soap just lost because then just cleared the whole shelf that's alone for cope with the production of soap. Because it makes sense. The moment you wash virus with soap and water, I was the one who went over radio, said that, but WHO was talking about using chlorine powder, which itself is a problem. It's effective against destroying viruses, but it's also a very potent carcinogen. That's chlorine. Okay, that's not one aspect. Another aspect is destroying the virus, not only on the surface, but also inside the body. Now, immune system we God give is a very powerful, as Nafisatu don't say, it's a very powerful mechanism where they, get rid of them, abnormality and the virus and all of that. But I will tell you, sometimes the immune system is overwhelmed. So we need for boost them. It can be boosted up by there are certain agents we are using now, where we use during Ebola, we boost the immune system, up. But that's one. We also use the same thing for actually directly inactivate the virus inside the body without destroying the normal cells. In fact, the normal cells, then they activate them, they enhance the activity. So now that's something I get for say. I don't talk too much about this, but the world tomorrow is going to be a better place than it is now, when some of these things are fully understood and considered. Thank you.
Thank you very much, Dr. Krio. With most of the stuff that we talk about how virus they behave, the setup of I think we Dr. Kamabi don't cover as well before. For people who can join with, they know say this as something we don't get covered. But thank you very much, Dr. Krio. You don't shed some more light on that. And for the one thing we not be done joining the program before, at least they don't benefit from this. For people who want to see that one day, if you go on the YouTube channel, the recorded version today, if I able get the link to them, I will put them now. If not, I will just put the link no more to the YouTube channel. So whosoever want to go watch the other session that we don't do before, you feel free for do so. Antina, if you want to add anything on waiting Dr. Krio say before I go to Mohammed Suare. You did on mute too. Don't worry, I'm not used to this. Anytime I did meetings, people they on mute. You did on mute still. I don't know what happened.
Yeah, but I just want to thank Dr. Krio. Thank you so much for that additional information. We appreciate that. Thank you so much.
I have a question before I go to Mr. Mohammed Suare. There's a question also they ask. Really, it does make sense. Yes, we talk about baby and the mama, but in recent times, I be don't hear something, where a papa been get this thing. Now, if the papa get them, waiting at the effect on the pikin. If the papa get them, so the mama get them, the papa don't get them. Or is it that if the papa gets them, he can pass them directly to the mama, then the mama pass them to the pikin? How does it work?
Very interesting question.
Okay, I've got to ask.
Obviously, yes, the papa can pass on to the pikin, but not to like the way. Obviously, we don't say man no they get pregnant, so we don't say not the grand already. The way papa can pass on to the pikin and do household exposure. Now, because I not deal with general hepatitis, I not talk a lot on that. But normally, when somebody get hepatitis, public health people are supposed to contact trace the sexual contact as well as household contacts and offer them testing and vaccination. So even though the pikin and the host, the papa no they carry the belly, for example, but the papa they only use the same bathroom, whisk then and toothbrush. So people they wash their teeth, then they bleed. So the pikin then get in risk inside the host. So yes, if the pikin are not protected, they can get infected from the papa through the exposure to body fluid and blood inside the host.
Okay, so it not go happen via say sexual intercourse basically. It not go happen say.
Well, we're not going to expect the pikin for get sexual intercourse with the daddy. But
no, I mean no. I mean when the papa and the mama decide to make the pikin, there's no way.
It pass that way. The hepatitis B they transfer sexually. If you come in contact with an infected person, then you're not protected. Obviously, if the man get the hepatitis, he infect the woman. Then if the woman gets pregnant, he get the virus, it can pass on to him pikin. So now when we work with hepatitis, one who sign out the source of the infection. One of we work now for find out the source. but not in chronic case. We need to find out a source for a chronic case because also I will begin. Remember, I've been on talk say it can take 6 months for let you know. If somebody chronic, it can be say get them 5 years ago, it can be say get them 2 years ago. We need to go find out the source after 5 years. We're more particular about the source for the acute one, where we say in the last 6 months you get them. We'll find out the source. But then very important, you vaccinate and test the household contact and sexual contact. Because yes, if they pass sexually, and the people in the host, they're at risk. Picking them as well as adults. Yeah.
It makes sense. Okay. We get Dr. Bell. Dr. Bell, you get anything we will add towards this on waiting until if you don't say whether you want to get some few points or you want to make new points on what you don't say? Because I see Mr. Sumaray don't put your hand on. I think maybe in question and get answered.
Yeah, no, good evening. Nafi don't say all thing. I mean, Nafi, that was a very, very good presentation. I hope say this also go out to different people in our salon. We go Bedi, like the health sector. We go try for implement the bath dose because that's the one main campaign we for go on a salon at the moment. Also concerning stigmatization, that I want to talk about. That's something we really bad in a salon. We come to sickness, not on both sides. Because we get the sickness and in surroundings. It's really bad how people get afraid for talks on certain things. So I make if I say some people are afraid for go to a doctor, they're afraid for me to go do the testing. At now one thing that the way we get for try for minimize na salon, the way how they stigmatize people, we get sickness. As you say person get virus, you don't begin to think so kind of funny way. And not only that, I mean, even the way to about person will get cancer or people that always they try for hide the illnesses where can be really bad for society. So now one thing that they way we want put into this talk here, so this awareness, say we for talk about them things, then for talk about them things, then for encourage doctors and for encourage the doctors and health professionals for encourage people that for do testing. For instance, if the woman gets Bεttεh, it go do a test. So say if you take a man safe, then also go do the test. It's very, very important for minimize stigmatization. That's very, very important in salon, because if we do that, we know go before and this health talk. We go just talk now, so but they're not going to implement in our salon. So one thing and the way I think say we serve as well, Bɔdi Bεttεh Pass Gentri, we for carry that message go na salon say we for stop for the stigmatized people we get certain sickness. Not only the sickness, also handicap. You also see that in the back as well. And that's really bad. And I think say we for actually raise up a campaign against Dandy. That's very, very important.
Thank you very much, sir.
Back to you.
Yeah, Mr. Mohammed, I come to you. 1 minute. I just want to ask something. I don't know, Auntie Nafi, if you be covered breastfeeding. You been covered breastfeeding?
Yeah.
When I talk say yes, now one of the ways that where the mama they pass the infection to the pikin after we don't born and we the nurse her. Yeah. Now that no matter talk, but it's a question will different from which.
So you say if the mama get them, it's not safe for her breastfeed?
No, I not say that. I just talk say now one of the way they pass her. But now good point you raise. I mean, if I been expect this question for come up, I've been very surprised if nobody ask her. Because
before I cannot get the question.
So breastfeeding are one way where the mama they pass on to the pikin. However, the WHO they recommend say the woman for breastfeed the pikin. They say because the benefits for breastfeed the pikin they outweigh the risk of infection. The reason being is that they don't recommend the bath dose. Once you give the bath dose, they sort of protect the pikin. Around 90% of protection, one vaccine dose can give. So as you don't protect the pikin that way, you for encourage the mama for breastfeed. Because we know say, me not a midwife or, me not an obstetrician, but people that when a midwife or obstetrician will agree with me say, Bobby breast milk gets a lot of benefits for pikin. You know, they protect the pikin against infection them. They get some advantages the way, you know, they buy them, you know, they cook them, you know, they are readily available. So because of that, WHO said, and they highly recommend the mama for breastfeed the pikin, even if you get hepatitis B. Because once you give the back dose, you go down sort of reduce, you know, the risk to the pikin. So yes, then for breastfeed.
Perfect. I got more question, but I will go to Mr. Mohamed Sware. We don't wait. Yes, boss. Mr. Sware?
Yes, good evening.
How are you, sir?
Thank God. First of all, I want to say thank you to the presenter. I think you don't able my own the presentation.
Thank you.
Being one of the people we been in that video where last play, and we want to send a very good signal on certain issues. But I'll just clarify issues related to the vaccination of bad dose or giving bad dose vaccine.
Yeah.
Of recent, we get small project we want for do now Konoya, so we want for do bad dose vaccination because WHO say everybody for be vaccinated, every picking when they born. More na endemic countries than country where get an affected percentage of more than 8%. So when we try for do that, of course you not go do anything, you know, talk to the DMO and later the DMO talk to the ministry. So there was this huge challenge where we try to implement that. We get the vaccine, we say we want to do this, then say. So when we take the talk to ministry say there is no policy binding that. And therefore, anything where you go ahead for do, anything happen, you get yourself for be blamed and to be responsible. So I think that question gave a day around policies where you gave to do with this particular thing. So now make, even if an NGO donor get vaccines, we're not going to vaccinate any picking when a bad dose vaccine because of that policy where the government not change it. So currently, now that makes they not vaccinate babies the way they born to hepatitis B mothers. For example, Kono, we get one protocol where we use say if you get exposed because your mama na hepatitis B mother, then the policy we been get some dose of vaccine where we get now we were house will be like roll them out for a certain number of months. But since we done it done, we know it will continue again because there is no policy surrounding that. So in general, government still lacks a lot of things them where they not set it, where they need to follow the global protocols. And as my sister rightly mentioned, a huge challenge because I got problem with the immunization schedule for hepatitis B in general. If you say at 6 weeks, 14 weeks, so even before the pikin they get the vaccine, at that period, they already don't contact the disease. And currently, there is no protocol where they say, before you administer that vaccine, you need to test that baby. There is no protocol that says that. So you don't even know whether you can vaccinate person who already get the disease or who already don't contract the disease. So there's a huge problem. And I just hope, say, as we all raise awareness, we will continue to open the eye. The government, I don't know if they don't know, but I'm sure they are aware. But the challenge we didn't get, because one of the time the way we say, when we meet with them was that, looking at the continuity of this plan, for example, if you say it starts small, looking at the continuity plan, say we will do one for other districts, them, other places, them. So that was a huge challenge. So basically, now that as we speak. With regards to stigma, of course, Sierra Leone, nobody wants to talk about communicable disease or even other diseases were not communicable. The only disease where somebody gets mind for talk na that I get malaria. Even common hypertension, people get stigmatized. You know, people get, but I think it boils down to the level of education, the level of exposure to certain things. Because if people now other countries, then they take HIV very common. As long as you get the medicine, you get chances not for transfer to other person. But that level of education, we not get it. So I think we need for taper up with preventive messages. We need to go up and talk to people and say these things then they exist, but there are other methods of prevention. So thank you very much. And so lucky today for attend the presentation, and I will follow the YouTube channel as well, because me and one person we like preventive medicine so much, and I go love for be part of the platform and perhaps contribute subsequently. Thank you.
Thank you very much for your offer, Mr. Swale. I will share with WhatsApp number and also with email. It will be nice for you get in touch. You know, I'm sure there are ways that we'll be able to collaborate in the future. Things like this, then kind forum, yeah. Some of the advantage where they give is that they bring up topics that are them issues here for we able to discuss them. And you never know who are they within the audience where you go able to take this forward and, you know, try for foster that conversation at high level. Okay. I'll not make any I'll not make any promises here because we not get you know, within the limit. I'm not get empower the or that influence different influence anybody. But what I can say is there might be people within the audience we might get in touch, we go and talk to you on this, or maybe go get the influence for talk to people higher up, you know, we're going to influence them for maybe for let's start getting any kind of conversation where in future we will able to make some changes. Somebody asked a question. Dr. Bell, you can jump in if you feel say you can able to add on this. This person asked, so in the situation in Sierra Leone that at the moment when babies are vaccinated at 6 weeks, is it still safe for mothers who are positive to breastfeed their babies at birth?
No, well, now Nafisatu go answer that now. You don't answer always.
Yeah, but because the person in question different. So
but the thing way more important, the thing important is that if they're not saying the mama positive or not, and if they're not saying the mama positive and they're not able to get the vaccine, that's now I may not understand why make Dandy no go be a police in a salon. I mean, if they no say the mama positive, I mean, and it is recommended by WHO, waiting go hinder that pikin day, but that baby day as he born for make it get the birth dose. I don't understand that. I mean, it's maybe if say okay, if it's not available, then I want to understand when the vaccine not available. But if it is available, and you know, say the mama gets you get hepatitis, I don't understand why make the pikin not supposed to get a vaccine. So if the mama gets hepatitis B and it born, then definitely they get for also make sure say they check the pikin if you don't get a one, and secondly, if you don't get them, you're not supposed for breastfeed. But the question is now if you don't get her already, yeah, because Nafisatu said if you don't talk her, 9 out of 10 they get her. You know, so if you don't get her already, then you don't get them. So the question is, it's ethical issue now. Well, they get the breastfeed, they still breastfeed for the other benefits that we will get because they don't get the hepatitis already. That's an ethical something we don't really think about for the talk about. But as I say, I don't know, I don't understand why make this for being an issue. I don't understand why make this for being an issue. Say if the mama gets hepatitis B, why make the pikin not forget birth dose?
I'm sure these are questions we.
I can just add to what Dr. Bell said. I agree with that. Myself not able to understand the rationale if the vaccine did why make we not forget at birth because they're available. Yeah. We just need to shift them from 6 weeks to birth. And coming for make the policy, we come together as health professionals at the country. We able make policy able make them, you know, discuss them. Bring up an issue, talk about and put policies in place, share them to people away and the appropriate people there. When I get a date for implementer, maybe it's not as easy as I talk them, but if they plan and they go forget them. I want to add to what Dr. Bell talk about. I think say somebody talk say if the pikin don't get 6 weeks, I think that we Bodi and I cannot talk say if you don't get 6 weeks, you can't get the vaccine. You don't even know if they give vaccine to somebody who don't get them. Okay. Waiting Dr. Bell talk is that you need for test that pikin day first because sometimes you don't even need the vaccine again. You don't already get infected. You get the vaccine. it's not cost effective, you know, you don't waste the vaccine. Although there's no harm in giving the vaccine where the person don't get it. You know, doing body any harm, but you don't waste time, you know. When it comes and cost effectiveness, you don't waste time. And the main thing, we try to get the back dose. We picking them. If we not get the back dose, we cannot meet the elimination goal by 2030. We need for the give the picking them at back and test the mama them as well. Thank you.
I think it come back to what Dr. Wẹll said. The stigmatization is an issue. We again follow the limited testing where probably then they do not alone. I feel say if they increase the testing, then some of these issues will get answers. Because if you know, say, this Wẹll woman now hepatitis positive, then you get statistics maybe nationwide, say, this year we get, I don't know, 40 or 30 or 300 or whatever number of hepatitis B positive Wẹll woman there, and then they born them picking there, then there is no policy for give back those to picking there. Then perhaps this will pile up and the government will do something. But if people they're not a test or there is no testing policy, then it becomes difficult. And the testing policy is not there because maybe the stigmatization or the testing facilities, the test kits, they are not readily available. So it's a whole kind of problem with the need for solve, maybe stage by stage. That's what I think. Thank you.
Yeah, all on our contribution is salient. It could say not to one person they come off from, and it could only pick up momentum with more people and they raise the same issues. I believe say this program not to just be waiting on us and Nayana with the watch out. There are a few more people that we get influence with the watch out, and I'm sure at some point there'll be discussions as to the rationale behind why certain decisions are taken. I don't know, but like I said, the only way for we able address the issue is about having conversations so we can see things as well from the perspective of maybe, say, for example, the Ministry of Health, you know, which are the constraints they would have, which are the rationale behind certain decisions. I'll get Mr. Dabo your hand up, then I'll come to you, Dr. K. We'll be on 1 minute, please. Mr. Dabo?
Yes, sir. Exactly, which I just want to add to what Dr. Wẹll and Nafisatu say, and you see, I believe to say government policies, especially when it comes to health, they depend more on the health professionals themselves. So if the back dose issue where the vaccine available, but they not put measures in place for let them go able to follow down the up, I believe to say to a very large extent, you know, I wish this recording will spread them for let people them will listen and let them know say, you know, we medical association or medical people in our salon just for step in because it bother on ethics and moral issues now in this case. Because if the Peking they develop hepatitis by any means because of that back dose issue, where the health professionals are way did it complacent about I believe to say then say get for blaming, and we're not gonna blame only the government because if they push for that, no government in the world will listen to them. Nobody, you know, because they don't go study them, they don't pass we, they know, and this now all obligation with the WHO don't talk and say they want to let them go eliminate this by so time. So time they against we. That I believe that then trump card and they now that become the first question I want to ask Nafisatu to now that I ask what have been the problem? What are the problem for this back dose? Where the measures are not put in place, why they not put the measures there in place? Do you have one for the una say put una, you know, una strength behind them, especially the doctors that will get now, they carry a lot of respect, and people that they respect now not only for una profession but for una dedication to what una they do so, una they try hard, in our own small way, for now educate people them, na salon, and even we appreciate una and we believe so that they do, you know, from our own ethical background and for our conscience. Do you allow una try talk to our colleagues and let them come together and see what you know do about this back dose? Otherwise, it would be difficult for them to point fingers at anybody. If them push, they're not able, then they make una know something. When I'm able to tell we, then we say we're able to try and see how we're able to create a platform like that fella na kono in prepare for that thing. And we will try hard and see how we're able to put people in together. We're able to go make some noise. I've been that because hepatitis, like how me never know about this much. Like how Nafi say Now a very deadly disease. Now a bad thing. You know, it affects innocent people in a way that parents don't get them. You know, and they don't get them. I mean, I'm able to talk about this because this is really frustrate me. But we are going for Dr. Bell and the others, Dr. Kama, you know, na Fiona Self, when I try hard and see how best now be able, you know, influence people that were in the medical field. The most get medical association they and the way when I go know about. Let us see how I able to ask questions. Then they will tell now voting now the hold up for these measures whether for put in place for this backdoors. Because it is frustrating, it is not, you know, nobody ever understand until today. Now then I go able to say thank you.
Thank you very much, Mr. Dabo. What you say so now I ain't able to try for say. The thing is, I'm not going to call anybody name and stuff like that, but I believe say some of we get people that we will be able to have a dialogue with, we may be able to influence some of them changes there. Giving me your own professional background, when it comes to risk and things like that, when it comes to decisions, there's always, for me, I can always be conservative when it comes to making an opinion. Because until you understand the rationale behind the decision and also the challenges, you know, I can't make certain comments. So for me, I'm like, you know, the best thing it would be for the right engagement and dialogue, be, you know, letting a whole as an output, we go know exactly, you know, from their own viewpoint, why make certain decisions are in place, you know, why make certain policies are in place, and waiting and cable do for maybe either remove or reduce some of the thing in there. Because to be honest, policies are there for a reason. Now, if they not put certain policies in place, some of we now go say why they left and willy-nilly for everybody for doing anything where they want. So maybe that might be a reason why then certain policies and then they're in place. But until we have that dialogue, we have that conversation, you know, we will never know. So all I can say at the moment, I can't say categorically clear that yes, we are going to influence this, we are going to influence that. No, all I can say is people then we get influenced, they listen, and I'm sure at some point discussions will be held. But definitely, like what you say, and like what other people don't see as well, it's a multifactorial issue, and also everybody get for come together. People from various disciplines get for come together for try for address some of the issues, and not just for hepatitis. There are lots of other issues that we need immediate attention. But I'm sure with that kind of dialogue, yeah, things will be better. Yes, Dr. Krio. Yes, sir. And we family do I ask Dr. Krio and try and make your contribution as small as possible because we don't really go over time, please. Yeah, Dr. Krio, go ahead, sir.
Yes, and I think basically the main reason or the main problem is money, funds, you know, and the guys who are controlling the funds are the ones who will determine some of these policies, regardless of waiting, because intelligent people are on the ground, they are making sound recommendations, but they will not listen to them. Right now, I'm in Abuja. Unfortunately for Sierra Leoneans, when you are in the salon circuit, they don't listen to you. Except waiting you, they say somebody else go tell them. Then they go listen and then go implement them. So you know, that's the biggest problem with us. You know, we do not respect our own. We do not listen to our own. We do not care about our own. You understand? The reason why they go step by step, so because if they really care, look at how much then they pay nurses and doctors in that country. They don't care. So it all boils down to money. You understand? And people will take their work very seriously if they are adequately compensated. And the, you know, the story goes on and on and on. You understand? And that's it. People then can tire for the go back to the same people then with the same story. And so probably when they hear I'm from somebody else, it go better. I'm done.
Thank you very much.
Oh, okay. Then I would want to add that it is not only hepatitis and Ebola that's able to what you call it, you know, to inactivate or neutralized. In fact, the first virus we were able to neutralize was the HIV virus. So then when we did that, we had to be very careful because there are certain quarters who will not be very happy with us and then can send all kinds of things against you. In fact, when we made that proclamation in Cape Town, we were put under strict security watch until we left South Africa. So you know, some of these things in medicine, we didn't look and say, oh, the professional aspect, the this and the that. No, there's a lot that goes into it. There's a lot that goes into it. So virtually even the COVID virus, we inactivated COVID. So in fact, all viruses can be inactivated. That's what I'm saying. So we can reverse any of the syndromes. Okay. So that's all for now. I not go Lano put myself in trouble. Bye.
Thank you very much, sir. For what you say, this is also something we just special to Salone. Even in most of the workplace them. For example, how they work as a contractor, for example. Some of the place they go not to like they now can get the people with the expertise or the knowledge for implement some of them things they are willing to do. However, because they already did another organization, they could only tell them for years, say we need this, we need to implement this. They won't listen to them. But the moment with somebody like a weak inside, they pay me so much money. If I tell them, say, jump, they will start jumping because obviously they look and say, well, they pay me. And as somebody new, a new voice that they listen to. So I understand the frustration. But like I said, because of my public program, I therefore be very careful as well and mindful of what I say. All what I will say is, like I said, there will be conversation.
So sometimes we go bleach. We go bleach ourselves so we get different color. Or we begin put some kind of accent when we talk, you know, so, you know, because that complex day, na Salone, bad one. This is something that I don't see in Nigeria.
It is.
Okay.
I'm sure we're not going to resolve to that day. At some point, the right conversation will be held in the right environment, and hopefully by God power things will change. And because of time, dear me family, Anti-Star, where I come to you, it will be your session plus your last word, please, yeah? Because we really don't run out of time. And can you please make it as short as possible? And KDC, I'll be coming to you as well. But please, low try for make them as short as possible. We really don't run out of time. And that's now a very important topic. Even me, my own question, I not go through all, but unfortunately, time we get for respect people and give them the time back, please. Yeah, Anne?
The question I'd like to answer. Thank you for the presentation. It was brilliant. But what I can't understand is why can the government in Sierra
Leone, yeah.
That's it, thank you. Not help the people more.
Yeah, that's exactly the conversations we're having now. Dr. Krio, who is a doctor back home, has raised some of the issues and the barriers and challenges. And also Mr. Mohamed Suare, the guy that was on one of the videos. That's some of the issues he's raising that one, there's so many red tapes that they have to get through, there's so many hurdles, but also there's financial, barriers. There's so many barriers that are in place. And some of these things can only be removed through conversations and dialogue and stuff. As to why they're there, I can't categorically state. I don't know. And also, because of, like I was saying just now, a few minutes ago, that it's a public program. So there are a couple of things that I've got to be mindful because I've not got all the facts with me, so I can't make certain statements. And
yeah.
Professional perspective as well. Before I make any recommendations, my way of doing things is always trying to understand the as is, trying to understand why are people doing things the way they're doing it. Until I understand that, then I'll be able to make recommendations as to how things can be improved. So it's the same thing as to how things are done back home. We live here, and most of us don't go back home that regular, so we don't really understand, the rationale behind certain decisions and the politics that is happening. I'm not talking about mainstream politics. I'm talking about why certain decisions are made, why certain policies are in place. Until we have that dialogue, we'll not have the bigger picture. And I will still come to you. Just bear with me 1 minute. KDC, please, can you give your points, please? But try and make them short and big. KDC?
Yeah, yes. Yeah, me on a very short one. Good evening, everyone.
Like that. How are you? Welcome.
Thank you. I just want to tell Nafisatu plenty thank you for the presentation. I really do in a way that even the grassroots people there go able to understand this, and I hope so they go able to use this and educate people the more. And even for we the health workers them refreshment for we certain things in the way maybe will not be in sabi or will not be aware of through in presentation. We don't able for update, we able for renew, and we able for update we knowledge there about the hepatitis. And then we hope say the this message go reach the government and let them try for implement this first dose vaccine for the baby them. And go. Nafi, I just want to tell you, say you do this presentation with all your heart. Thank you very much.
Thank you.
Thank you very much. Antenna.
Yes, I go echo that the presentation be very good, Nafi. Thank you so much. So the only thing we our add when it comes to children, babies, and elderly, then are vulnerable groups. So we all get duty of care and responsibility for protect them. So I'm really saddened by the fact that this they go on. They not implement this vaccination program for babies where they not get voice. Now we therefore talk for them. So I hope say, I know say we healthcare professional colleagues then at Sierra Leone, they do a lot already. So I hope say, the awareness, if they raise the awareness, to the people in Sierra Leone, the mothers, parents, maybe then they go help them for begin ask for this vaccination, and maybe that go instigate the people that were responsible for take the necessary action. Now Daniel Mawad.
Okay, thank you very much. Auntie Nafi, as your last word, where you go to give you last word. There's something where while because somebody asked a question there. So if the mama get vaccinated, would that reduce the pikin chances of like catch-am, and when the pikin born is still need to get vaccinated? So all that thought, I go around the panel, but why can't you go answer that? And also Dr. Bell, why can't you as well? If you can able podcast on that, that will not be a bad idea. But my family, thank you. I can't thank you enough. But unfortunately, every good thing get to come to an end. And when they come to the end now, so they can't go around the panel of the Bodi Bεttεh Gentri team. Let everybody give their last word. So Dr. Rashid Conte, I'll go to you first. Then Auntie Angela and stuff. Please, Dr. Rashid, make them very short, please. I beg. We really don't want out of time.
Yeah, thank you so much, Auntie Nafi, for the wonderful presentation. I think Fambu then don't get the message, so let we keep the good job and educate the people there. Thank you.
Okay, Dr. Angela and Samu. Thank you, Dr. Rashid.
Yes, good afternoon. Thank you very much, Nafisatu, for the presentation. I think you don't do an amazing, well, not I think you don't do an amazing job. Thank you.
Thank you.
I just want for the echo. And then I want to say thank you to Mr. Sumaray as well. Thank you for holding the fort and continue for doing what you do. But just one, I'm not saying put me on, but I've put on because I just wait for the last word. And I think the takeaway message when I highlights my last slide. And in general, when it comes to disease prevention, in multifactorial, involve healthcare providers, politicians, so many different things. The word there out there, studies have been done. I don't think so we forgive up. I don't say yes, salon in general, they can let people listen to, different people. Then when we talk, they know they take me serious. But normally we give up. Let we keep pushing, let we keep fighting, and eventually, I should say, we go able for get the politician and for do the work. The good thing, we get a lot of doctors now. We don't be part of the political party. Recently, they appointed a very young lady, and Dr. Charles Tennessee as well. Then don't be, I think, Minister of Health 2 and 3 or something like that. Let we continue for just a push and continue for the talk. Let not give up. And my family, and not forget, all the word way people don't talk now, especially in Nafi. Go out and spread the word. As soon as all know, well, Bodi, a better country. Thank you, everyone. Over.
Thank you very much, Auntie Angela. Dr. Kama? if you're in a position for talk.
Yeah, I just want to let tell Mama Nafisatu, lay hand blow, let's stop for share. They don't do a tremendous job. Are they far away? They not be able to pass through the door. You know, that's how proud I feel. You know, it's absolutely superb. And I tell you, thank you, we get such a team. As I say, they don't hear which will they talk. They know exactly which they get. We then go doctor, they don't come on this show. And as it is, they spread the word. We do the best way we can and make sure say this is what they go. As my colleague, Dr. Antizamu, talking just now, we no go tire. As we don't begin this so now, so we go full blow. And thankfully, we get to several people that will not say we go for talk to now. But the battle just begin. As I say, the war, not very difficult for end. But the battle will they fight now, we go fight time and hopefully we go conquer with the war. But remember, without una support na salon day, without una young cry na salon, we can't go forward. So now make the noise say, una don't hear waiting well, Bodi Bεttεh pass Gentri to do. Therefore, let them hold the idea strong, say yes, now for carry them people forward. So we will get the word now the big goals, we then go take, pay attention to we, and then we carry forward the message. So as it is, well, Bodi, he Bεttεh pass Gentri 10 times. So thank you so much, Unakam, and God bless you all.
Thank you very much. I don't know if Auntie will be there with me. Dr. Bell, you want to go? Please?
Yeah. Yes. Nafi, thank you very much for that presentation there. It was a very good presentation. I mean, myself learned a few things there. And it's fine for no get the small picking or the baby that's a voice. Because through this talk also, I can imagine say you don't save some picking them, some baby their life. Somebody be asked now the message if you're able to vaccinate Bεttεh woman there. Yes, you're able to vaccinate Bεttεh woman them. So that means if you then are highest area and the woman wants to be vaccinated, you can actually vaccinate the woman for hepatitis A and B as well. Concerning the stigmatization, I don't go stop for talk about that in there. It's very important. We try for stop that in a salon. It's really bad. They make people know they come forward for talk, and sometimes they make people in this spread diseases them because they know they talk. And I believe say now one thing, if we for fet that day, we were able for make people and they go on and get themselves tested. Because if they're afraid for being stigmatized, they're not gonna be tested. So I think that one thing that they will try for fet for. And concerning policies, they say that the people therefore listen to other, they need to listen to we, then they listen to other. Well, also we talk WHO talk. So that's what we got to tell them. We just say, repeat within WHO say. So if they don't want to listen to we, let them listen to WHO. Well, Bodi, Bεttεh pass Gentri.
Thank you very much, sir. Auntie Nafi?
Yes, and all thank you for all the contributions, the comments, and everybody in the audience. Thank you for listening and thank you for joining. Thank you for all the valuable feedback and valuable questions they want to ask. Mr. said they learn from the question they want to ask. I just want to add to what Dr. Bell talk about vaccinating pregnant women. Yes, if you test the pregnant women it's negative for the hepatitis, then it's susceptible. It means they're at risk. Don't get natural infection when body don't build up so German them. Then you need to get the vaccine. No evidence, no, they say the vaccine bad to the beginning. Date. So yes, the pregnant woman can get the vaccine. The other thing I want to say now, so the message I want to take home again. Well, if you did at this call, you don't know your hepatitis B status. Whether you're a health professional or you're not a health professional, try test, make you know what's in your status because the country endemic with the virus. You go come in contact with them one day, whether you're a health professional or not, although yes, they say that then they're at risk. But there's a lot of things that happening in the country where go predispose you for where you get them. So make sure so you check your hepatitis B status, make sure your family get tested. If you're not protected, make sure you get vaccine for protect them. If you're already immune to natural infection, you don't get the need for take vaccine again. And if you already get the chronic infection, at least you better, because you don't want to forget them. But if you don't end up getting, you go no say get and then you go access the service where you need. Because you need for them under a specialist who could monitor you every 6 months, check your liver function test, check your viral load, do your liver scan for you go live longer. So now my own message down there to when I take home. When I thank you for listening. I think one question we be asking, I say, if you don't vaccinate the pikin, mama, whether the pikin self will be vaccinated. Yes. When you vaccinate the mama, you only protect the mama. You don't protect the pikin yet when you go don't can at this wall. You know, the mama protected, the pikin not there at risk from the mama, but they're at risk from external sources. Don't forget, they play with other pikin them, they not host sometimes somebody did it. So yes, the pikin still need for getting vaccine. Thank you.
Thank you. I'll just add to that. Yeah, yes, TM, sorry. I just want people to understand, say, if we can maculate Belle woman then with COVID vaccine, we not be know much about. Yeah? There's no reason why we not for do unto woman them where they expect Pekin. You know, this COVID way they come back to now. A lot of people don't know say COVID don't they come back home.
Yes.
It really they big time. The next one where they cancel now BL, which they call on 24, 27, where the ancestor have been the stealth one. We at one point not been able for vaccinate Belle woman then. It came to the point after we don't do the analysis and everything, all the research, we definitely come to the conclusion it's better to vaccinate the Belle woman them than expect them to get the COVID and then the picking them pass, then get them through and then get problems. So vaccination of the mama, now the main way for actually get this thing down to the level we want them. WHO don't talk, we just never follow suit, but we're not going to time for talk about this stuff. Thank you so much.
Thank you very, very much. So all the doctors that we don't contribute today, and to Una, the participants, Una don't come now, and I made this program successful. I don't get much for saying this. The only thing I get for saying, they don't tell on all the thing already. It's better for let you know than you don't know. The worst thing is that for let you get something you can't take and go pass on to somebody else. But worst of all, to you picking. So dear, let get tested. And if you don't get tested, you know, so you get them. Make sure so you follow within the guidance with doctors that they give. Till we meet again, dear Lord, take care of yourself. Well, Bodi, be better.
Gentri.
Good night.
Thank you so much, everybody. Thank you.